Medical supplies in Tigray are depleted due to the two-year gruesome war. Accordingly, chronic illness patients were forced to terminate their medications, and many are dying from treatable diseases due to lack of medical supplies. Chief Executive Officer of Ethiopian Pharmaceutical Supply Agency of the Tigray branch, Alamayo Gebremariyam, says, though medical supplies were starting to trickle into Tigray, the amount and types of medicines are far from resolving the shortage of medical supplies on the ground and the need of the society.
ነቶም ዝሰዱልና ዘለዉ ናይ ፌደራል ትካላት ክነምስግን ይግብአና
We're grateful for the medical supplies we've been receiving from the federal institutions. However, the amounts of medical supplies that started trickling are not matching the need of the society on the ground. The amount of medical supplies that we received so far could only meet the need of 2 or 3 hospitals in Tigray. So we are forced to unevenly distribute a little amount to each hospital and health centers in Tigray.
According to Alamayo, though there are more than 30,000 diabetic patients in Tigray, the insulin that arrived so far would only be helpful to treat 4,000 to 5,000 patients.
ናይ ሽኮር ሕሙማን ጥቀሙሉ ኢንሱሊን ዝበሃል መድሓኒት ኣሎ
Insulin is a medicine for diabetic patients, so the amount of insulin that arrived so far is only helpful to treat 4,000 to 5,000 patients. But the amount of insulin we need is for more than 30,000 patients. Metformin is also another medicine for diabetic patients, but the amount we have at hand would only enable us to treat a few hundred only. So we're only appreciating the beginning, otherwise the need and the supplies are disproportionate so far.
Alamayo also says the need of basic medical supplies in Tigray is still critical, though there is some improvement on health program medicines.
ናይ ጥዕና መድሓኒታት ንብሎም ወይም ደሞ ሄልዝ ፕሮግራም ንብሎም
The supply of health program medicines like TB, HIV patients and vaccinations is improved compared to the past 2 years as there was none. So far, we've received vaccinations and ART medications for HIV patients, which could last for 2 months, but the shortage of basic medicines is still critical. RDF medicines are purchased by the internal budget of health centers. However, all this is unimaginable for health centers in Tigray, as they are working without getting any budget for over 2 years now. So there is a great shortage and need of basic medicines in Tigray.
It has been more than 2 months since a peace agreement was signed between the governments of Tigray and Ethiopia. However, people in Tigray are still dying of treatable diseases due to lack of medical supplies.